Hi guys, and welcome to this course on the cardiovascular system. The cardiovascular system, perhaps one of the subjects that people tend to find the most interesting for some people, because you come from A levels or you from college and you've studied so much around the heart, and then cardiovascular system or cardiovascular disease, as we know, is the number one killer. So there's quite a lot of information here. We know quite a lot about the cardiovascular system, perhaps one of the most studied systems we have in the body. The cardiovascular system in the BNF kicks off first with arrhythmias. We'll look at when your heart simply just is beating out of sync, what causes it, what can we do to stop, prevent it, or get it back into shape. Then we go into bleeding disorders. You'll be familiar with a lot of terms here, from hemorrhages to coagulation factors and deficiencies, or in menorrhagia. We'll look at that as well. Then we have blood clots, looking at thromboembolism, a term you might be familiar with. I remember this from early days in A-level science. And then we have blood pressure disorders or blood pressure conditions, hypertension. This is a very practical subject. In community pharmacy, you might have had the opportunity to take a few patients' blood pressure. We may be familiar with some of the guidelines when it comes to hypertension. Then there is cardiovascular risk assessment and prevention. There is heart failure. There is hyperlipidemia. You're going to look at statins and reducing cholesterol. Then we'll look at myocardial ischemia, which is everything to do with heart attacks, from ACS to MI, and then of course edemas and vascular disease. You may be seeing a lot of services these days offering treatments they say for vein malformations. So this is a very hefty chapter as well. There's a lot to learn, but this is a high yield chapter. Cardiovascular system is something that is a big priority for us, because this is a very large chunk of the exam. So if you know everything in this chapter, at least master everything in this chapter, you'll be setting yourself up well to pass the pre-reg exam.